Welcome everybody to our prevention panel. In the next 30 minutes we will talk about sustainable healthcare system in Europe, the importance of prevention. I'd like to welcome to our stage here in Berlin Aylin Tüzel. She's the country manager of Pfizer Germany. Very welcome.
Thank you.
And on the screen, we welcome Andrea Ammon. She is director of the European Center for Disease Prevention and Control, ECDC. Not to be confused with ACDC, but I think you're working with the same power as the music group. So welcome here on our stage.
We will jump right into the discussion. We only have 30 minutes, so we have to speed up. Andrea, starting with you. When we talk about prevention, of course, we have to start with the actual situation and the pandemic. And larger public now has learned there is no glory in prevention. Is that a problem for you, or does that maybe help your case more than anything before? And maybe you can give us some introduction of the work of the ECDC too.
Oh.
I think we have some technical problems.
Now she's here.
Now I can hear you.
Okay. I think you have to repeat.
Oh, okay. So I have to repeat. I hope you heard our warm welcome. So now we will jump right into the discussion. We only have 30 minutes, so we have to speed up a little bit. So, Andrea, when we talk about prevention, of course, we have to start with the actual situation and the pandemic. And the larger public now has learned there is no glory in prevention. Is that a problem for you, or does that maybe help your case more than anything before? And if you could give us a little introduction in your work and your
Oh, wow. That's a lot for the first question. Now, so good afternoon. And I mean, glory in prevention. I mean, if you think you can to get a Nobel prevention, maybe then not. But I think when you go back to, the old Chinese, a doctor was only paid as long as his patients were healthy. So not because he treated the sick ones. So prevention, the early detection, and then also, of course, control and rehabilitation are a continuum that is sometimes called primary, secondary, and tertiary prevention. And all three of them are part of our work.
So, Aylin, first question for you. I think the impact of the pandemic is probably huge on your work at the moment. Can you give us just a short learning? What is the biggest learning out of the last 2 years for you and your company?
Okay, this is a good question and a huge one again. But we all learned the preventive measures, how they work actually when managing the pandemic today, and the strategies that actually the strategies work to contain the severity of the pandemic in almost everywhere. We all learned to live with the masks, the isolation, the quarantine, the vaccination, and also follow up all those data. I mean, the hospitalization rate, the vaccination rates, and so on. And now we are talking about the future post-pandemic, the consequences of the post-pandemic when it comes to social, psychological, and economical impact of it. But I would like to mention another consequence, another probably a bigger one, where the diagnosis rates have dropped. The screening rates have dropped. The vaccination rates have dropped on other diseases. So there is a huge another healthcare burden that is coming along with the less screenings in cancer diagnosis, less vaccination rates in measles, in routine vaccination. So just to give you an idea of some numbers, in Germany, 30% less vaccinations were executed in 2021 compared to the pre-pandemic time, and those are measles vaccinations, pneumococcal vaccinations, HPV vaccinations. So this is another burden that comes along, and cancer screening, for example, according to a research group in Frankfurt, 9% less cancer diagnoses were done in Germany last year, which means that advanced diagnosis will come along post-pandemic.
Have you any explanation why it is dropping down?
Because less access to the appointments, cancelling appointments, and less access to the physician side at this point. And that is another burden that comes along how important prevention is in all terms, not only COVID-19, probably.
Andrea, look at the bigger picture from a European perspective. Can you give us some examples where things go maybe better than they went in Germany? Some best practice examples?
I think there is what has been described is really an issue all over the EU. We really look at worrying dropping vaccination rates, but also for diseases like tuberculosis, HIV. The treatment centers partly had to close because the staff was working on COVID. So there is an aftermath, not only because of COVID, but also on other diseases. And that is throughout the European Union. Of course, there's a diversity in the countries. Some countries have health systems that could cope with the COVID load better than others. But some kind of aftermath all the countries will have.
Aylin, you just said one problem is access at the moment, because many doctors don't even make any preventions because of the pandemic situation. But I think it's also a problem maybe of awareness about prevention. So how can we get people to be more aware of that? For example, in Germany, we have a very strict system for child's health care, but the frequency of consultation goes down as we get older. How can we manage that? How can we get the awareness higher for prevention?
So that is such a good question, and something that we are also working on with many of our stakeholders. Two things that we are doing. One of them, what is so important is to get this prevention in the healthcare system with a more stronger focus, with goals, with thresholds that we could really work towards. What we have seen and what we have observed in one of the research programs that we did with University of Bielefeld and Springer Magazine, a prevention index we worked on. And we saw that in Germany, we do not have goals that put prevention, so we don't have a vaccination rate goal for any of the diseases, or we don't have a cancer screening goal at any of our important cancer diagnosis, so that we don't have the accountability, responsibility, or the healthcare system that is pushing for further prevention. For us, we are spending almost 97% of our healthcare budget on treatment. A very small fraction is spent on prevention. For Germany, what we believe is going to be very important is a sustainable preventive healthcare measures, goals, and focus areas where we could play around.
Is Germany too skeptic about prevention, about all this stuff?
Maybe we are. Actually, I guess I cannot say that Germany would be skeptic, but I guess this was not on our agenda before. Now we are learning that this is going to be an important part of our future with the elderly population as well.
But when I think when the vaccination rate goes down now, that doesn't sound like a huge learning then. What do you think, Andrea?
No, and I think what has to happen is a change in the perception where prevention has to occur. Because right now we say, well, this institution does prevention. No, everybody has to do prevention. It has to permeate all the work that in health, but also for employers, for schools, for everywhere, that prevention is something that not something that a certain institution has to do. And I think only then we will get a better understanding. Of course, this needs to be started somewhere. So we need certain incentives and goals and targets could be one. But in the end, prevention is something that has to become, an integral part of everybody's life. Take hand washing. I mean, it's such a simple measure. Now in the pandemic, it was, of course, highlighted a bit more, but it helps every winter for influenza. It helps for noroviruses. It helps in the hospitals to prevent nosocomial infections. So, I mean, it's very simple, actually. So prevention doesn't have to have a big financial burden with it.
Mm. But maybe, Andrea, we can get a step a little back, because your institution is called European Center for Diseases Prevention and Control. I'm really honest, I have no idea what your institution is doing and how you can make prevention more awareness for prevention. So maybe you can give us just a short explanation. How do you work with the different states in the European Union together? What is your main goal?
Well, our main mission is to identify, assess, and communicate about threats to health from infectious diseases. Mm. Now, what we are doing there is we gather information, data on the epidemiology, who is affected, in which country, what are the trends, and so forth. We do assessments of new threats, but then we have also part of our work is working with countries on their prevention and control programs for certain diseases. We do it for huge project on vaccine effectiveness monitoring, and vaccines are the preventive measure per se. We also work a lot, for instance, for prevention in sexually transmitted diseases, HIV, and so forth. So we have the same conclusion that you had at the beginning, that our preventive work is a bit hidden in our overall work. That conclusion we had also. So we will now try to put this together so that it's more visible what we're doing. Mm-hmm.
But people are joking already when you talk about washing hands. People are joking, well, when is the pandemic over? When can we stop washing hands? Do you really have hopes that people can change?
I mean, part of this is a whole also communication, of course. I mean, we have already for antimicrobial prevention or reduction of antimicrobial resistance every year hand washing as one of the central measures. So I think we should rather take the opportunity now, saying, well, it has been it's not an additional measure that should remind people on the pandemic, but it's a measure that can really help to prevent a transmission of diseases, not only for COVID, but actually for a lot of other things that are much more part of our daily life.
I have a hope there, because 1.2 million people die every year because of antimicrobial resistant antibiotics, those that could be preventable or those that could be treated with simple antibiotics. And I have a hope there, because this pandemic will end with an endemic, and we need to learn with this. We need to learn in the endemic world, and we need to wash our hands, do our isolations, wear masks if we are sick. Really, we need to make sure that we are in the public environment to take control of ourselves and others. At schools, we need to learn how to navigate and how to live in this world. So I am so hopeful that for awareness, and we have grown. I mean, remember our way in 2020 and see how we have come along. I am hopeful that awareness will come to public when we start living with these conditions as well. And I'm hopeful that we will be washing hands. But it is important that the healthcare system also embraces the prevention measures, the targets, the goals, the data, and the data management with it.
Mm. What are the biggest problems with this, what you've just said in the end in Germany? Does this healthcare system doesn't support this really? Is it a wrong focus, or what are the main problems, do you think?
For me, I mean, two findings, two important things. For example, adult vaccination is not in the scope of the German healthcare system at this point. And we do have very low vaccination rates when it comes to flu vaccination, pneumococcal vaccination, or pertussis. So we don't have targets to focus on those. So we have, and we don't have measures. We don't know. I mean, we don't know how this trend will go and how we can increase the awareness, how we can actually incentivize the physicians who would do that. We don't create that awareness within the public among us. So we don't spend time, energy, and our efforts on this. And the second thing, which is important, again, I mean, like the screenings. If you don't ask anyone, or if you don't remind them, nobody would go for a screening or for dermatology or for a colon cancer screening when they age to a certain age. So I guess there has to be in the system measures, targets, objectives, goals on certain areas so that we can focus on those for the future. We don't have that in Germany. That is one. And the second one, we don't have the data to follow those measures because we don't have a concentrated or a networked approach or to bring those data together to drive the attention focus to the policymakers and healthcare providers.
Mm-hmm.
Data is a huge deal. We learned that also in the pandemic. What data is needed, and how could that maybe be, from a European perspective, improved?
That is a discussion for really another hour.
We have 11 minutes. Go for it.
I know. I will not use everything. No, but I think what we have seen also here, the pandemic has given us good opportunities. For instance, vaccination coverage. How many people are actually vaccinated in each age group is very difficult for other vaccines. For COVID vaccines, now it has been implemented. We have the vaccine tracker that monitors that, but now it's the task is to translate this for the other vaccines. And what we have seen is that many countries have upgraded their vaccination programs with electronic immunization registries, where of course it's much easier to get overview of the coverage, but also to put reminders to people that, for instance, a booster is necessary, not a booster for COVID necessarily, but for the annual influenza vaccine and these kind of things. So I share Aylin's hope that we have here a possibility, an opportunity to really improve also for the future.
Mm. Is this necessary for all European countries, or are there any countries where this is still in practice? Or is just Germany a problem there?
There are countries that have already such registries. Several of the Nordic countries have this already. Well, no surprise, they have high vaccination coverage.
Do you think this is necessary, I think, for Germany as well? I think there is a discussion going on about a vaccination data register. You would appreciate that,
Which would be so valuable because we don't have this. I mean, having this electronically and also having the reminder systems, especially for those who are, I mean, that's not top of your mind. When you have a baby, the pediatric scheme is always at the top of mind because it goes back to back. But when you come to a certain age, does have to be in your life, an electronic card. And actually in the COVID-19, the data and the awareness has helped us to see it works. Actually, it helps to get a reminder of booster, or it helps to get the second dose, third dose, and all that media support is really helpful. One thing I would like to add is that many of the countries are also in the COVID-19 situation have had pharmacies in the vaccination game as well. And this also, again, now Germany is also approaching to this strategy, which is a good strategy to bring the vaccination more close to the people where they are living and where the access is so easier. And in Europe, there are some countries who have already managed them and who now have more higher vaccination rates compared to us.
Mm-hmm.
Yes, I mean, it's nice to have these features now, right? I mean, we were walking around, or still walking around with our yellow vaccination pass. That's really absurd when you think about it in the year with 2022. Is that a major step now to have that people are used to, at least some people are used to using the apps and all that stuff?
You're asking me?
Yes, Andrea, sorry. I'm looking at you at the screen.
So I think there will be, of course, a transition time between the old system and the new one. But I think also here we have some opportunity now, and we have seen how it works with the digital COVID certificate. That could be something also for the future, not necessarily for travel, because I think that's a side use, but I think it is something that could ease the use of these electronic systems, and everybody, wherever someone goes, has with them what their health status in terms of vaccination is.
Aylin, what exactly has to be done that we don't fall back behind the time of the pandemic? So what has to be done to make this translation, as Andrea just said, to other health systems or other diseases?
Actually, Andrea said it very well. We have a lot of learnings, a lot of tools now that we are using in the pandemic. I mean, we are just showing our e-vaccination card entering any building, or we are actually following the data on a daily basis, the vaccination rates or the epidemiology of the disease and so on, the hospitalization rate, free beds in the intensive care units. So we actually are using many of the tools that we will be needing for the certain disease areas when it comes to prevention. We have come to a place where we understood that vaccination is important fighting against viruses, infectious diseases. So why can't we carry this know-how now to a next level and introduce these e-vaccination cards or pharmacy vaccinations or some targets for us? Because many countries have had their targets announced. You remember that Germany had a 75% vaccination rate target for the end of summer. So many countries made this approach to bring their goals into the picture. So I am hoping that we can continue this momentum, this focus. But one thing we need to change, we are just only focusing still on COVID-19 and the fight against pandemic. Now this is becoming a public health impact for the future, so we should broaden our horizon for other diseases. And there I would look at ECDC to bring us to which areas that we should focus further for a sustainable healthcare system of the future.
Mm.
Is that already the moment, or are we still too deep in the pandemic? What do you think, Andrea?
Well, I think that depends, of course, again, on the country, how much they are still in the day-to-day control of the pandemic. But at one point, we have to review really what has worked, what hasn't worked, and draw some lessons. very important for me is the recognition that to invest in health systems is an investment and should not only seen as a cost, which it mainly was. And that is also the problem of prevention, that it is seen as a cost. And not as an investment that will prevent not only disease but also costs in the health system.
There's no glory in prevention, as we said at the start, and we're almost at the end of our panel already. That brings us to our last question. Aylin, if you had one wish for Europe 2022, what would that be?
My wish would be to bring prevention to our agenda and as a strong holistic approach with collaboration across many stakeholders, because prevention is not a job of only one institution. Prevention is a holistic approach when it comes to education, but also when it comes to healthcare providers, but also when it comes to pharmacies as well. So I believe that taking a holistic approach and putting some pressure on prevention would be the key hope that I have.
Well, Andrea, what are your hopes or your one hope for Europe 2022?
Well, for me, it's really that we take all these collected learnings now from the pandemic to implement better systems so that people and everybody can pursue their lives as undisturbed diseases and maybe other diseases as possible. That's actually our vision for ECDC.
Great. So, thank you very much for this discussion. It was very interesting, and I think we have one wish that this pandemic is going to be over very soon. And then, of course, I think this is a very important topic, that prevention is going to be a very high European topic as well. So thank you very much for joining us, and all the best for you.